Your nose helps you breathe, smell, and taste, but some people feel it's the worst feature on their face. Dr. Nathan Nachlas of Boca Raton Regional Hospital here to tell us about a nose surgery that makes sure your nose continues to work as it should. Thank you so much for joining us, Doctor.
My pleasure. Thanks for having me.
Here's some questions. What is the total nose approach, and how was it developed?
The total nose approach looks at the outside and the inside of the nose,
Okay.
in simplest terms. I developed it a long time ago, about 25 years ago. And the way it was developed was that surgery for the inside issues of the nose, the sinus issues, used to be extremely involved. Back in my Johns Hopkins days, patients would actually stay in the hospital for a week after sinus surgery. They'd have incisions under their lip, incisions around their forehead to treat it. And then in the mid-'80s, at that time, a new technique was brought to Hopkins from Austria called endoscopic sinus surgery. And then we've since improved it to do it based on a computer. So we took that surgery and we made it into about a 1-hour outpatient procedure. So as the internal surgeries got easier, the natural progression is, can you also take care of external issues at the same time? And that's essentially the total nose approach. Patients who have internal issues can have the external parts fixed.
So who would the typical patient be who might undergo this procedure?
There's two general categories. The first is the patient who comes in for cosmetic change in their nose, to have the bump taken off, have the nose made smaller, who, by the way, says, I can't get rid of sinus infections. I get 4 or 5 sinus infections a year. I can't breathe through my nose, etc. And then the other category are patients who come in for their sinus disease, who have failed medical management and are candidates for surgery, and ask, by the way, while you're there, and they start talking about their external issues.
Sinus infections can be painful and annoying. Is this procedure painful that you're talking about, the total nose approach?
During the procedure, of course, there's no pain because the patient is asleep. Again, one of the things that we've developed over time is we use no packing afterwards. So when the patient awakens from anesthesia, they're breathing through their nose. So that greatly reduces the discomfort that was traditionally associated with nasal surgery.
Outstanding. How long after this procedure can someone go back to work and be normal as usual?
Going back to work or school is a 5-day event, 5 to 6 days. As far as normal, people feel fairly normal within 2 to 3 weeks. If we work on the outside of the nose, it's usually about 1 to 2 months until they really have the normal strength back to the outside.
All right, well, Doctor, we're out of time, but we thank you for joining us. And Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor segment.